I'm Linda Elsegood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us. I'm joined today by Dr. Bruce Berman from sunny Florida in the US. Thank you for joining me, Bruce.
My pleasure.
Could you tell us how long ago it was when you first heard about LDN?
At least 5 years.
Mm-hmm. And
I had read an article about it. I'm an addiction specialist, so I was very intimately familiar with Naltrexone, and I know that the side effect profile is very negligible. And when the hypothesis came of using low dose, I said, makes perfect sense to me. The benefits certainly outweigh the risks, so I started using it.
Mm-hmm. And what conditions have you treated?
Name it. Hashimoto's disease, any autoimmune disease, cancer, depression, fibromyalgia. Sometimes it's miraculous. I had a 29-year-old woman with ulcerative colitis was having 15 bloody bowel movements a day that nothing in medicine could stop them. We started LDN, and in 2 days, her bowel movements were down to 2, and they were normal.
Oh, my word.
We've used it it's great for the joint pain and rheumatoid arthritis. I use it as I do integrative cancer therapy, so I use it as part of an overall program in cancer, because as you know, the endogenous opioids have anti-tumor ability. Mm-hmm. Plus, they help balance the Th1, Th2 immune cells, so it's a double whammy against cancer cells, and it's just amazing. The worst side effect I've seen, and it's really not that bad, it's just bothersome, is vivid dreams and sleep may be affected. You may have early AM awakening, but I can switch them now with the research. We've now tried, and we've been giving patients the LDN in the morning, and it still works, and it doesn't affect their sleep then. Mm-hmm. So I'm a satisfied customer. A lot of patients are coming to me because they do research on it, and they see it. They go on the Cancer Tutor website and a lot of other websites and just do alternative therapies, and my name comes up, and I'm happy to give this service because it's so innocuous. It's such a benign treatment, and the effects can be dramatic.
And how long would you say, if pushed, on average, it would take a patient to notice that there are benefits of taking LDN?
I'd say anywhere from a couple of days to a couple of weeks. Usually within a month, you see some dramatic. I start low. I start at 1.5 milligrams and work up from there. Usually around 3 milligrams, you're going to see effects, and if you need to push it to 4.5, patients respond. But usually within a month, sometimes within days, patients respond.
Oh, that's amazing. And
it's anything you want in a treatment, it is. For instance, it's safe. It's inexpensive. It's easy to obtain. It has almost no side effects. It's like the perfect drug. And most conventional doctors are so pigeonholed that they will say, and this is the pat answer that my patients get from them, oh, I can't prescribe that. It's not indicated. When, of course, as you know, in the States, if you have one indication for a drug, you could use it for anything, called off-label use. But they don't want to do it because most conventional doctors they're hamsters on a wheel. They don't know they're spinning. They think they're going forward. That's why I had to do functional medicine.
Well, we certainly need doctors like you who think outside of the box.
Well, I was on the hamster wheel, and all I did was give patients drugs to placate symptoms. And now, I mean, when you address causes, the results are dramatic. Really, really dramatic.
Mm-hmm.
And that's why I'm here, to find out what's in my patient's highest and best good.
So in your practice, you mentioned Hashimoto's and cancer. Do you do all the autoimmune conditions? You know, MS,
yeah.
ME? Yeah. Okay.
Yep. Yeah, we use LDN in all of them. We also use bee sting therapy in autoimmunes, quite dramatic. They work together. They work together to balance the immune system. But here in the States, the LDN is so inexpensive. It's under $40 a month.
Mm-hmm. And how can people contact you? What is your website address?
PalmBeachHolistic.com with a single H, not a double.
Mm-hmm. And I'm always being asked by patients who can't travel, do you do any Skype or?
I do phone consults.
You do. Okay.
As long as they can get local blood work, and if they need to, just have a doctor on hand for any conditions that might need local attention. I see why not. I do it a lot. I have a couple of patients from England.
Really?
And I have one from South Africa.
Well, this Brit is rather scaredy cat, where bee stings would that doesn't sound very pleasant to me.
For your listeners, they should go to the website, the LDN Summit 2016. That was just held in Orlando last month. You can download and watch the videos on all the presentations on LDN. It was tremendous. And there's also a book now, the LDN book.
You do know that I organised the conference and I'm the editor of the book.
Oh yeah, I saw it. Oh yeah, I downloaded it. Oh yeah, because I can't travel sometimes, so piecemeal I did it. That guy's presentation on thyroid was amazing.
Thank you. Yeah.
It was just, yeah, really. I know some of the speakers. Marty Dayton is right near me in Miami.
Uh-huh.
So, because in our field, what we do in functional medicine, the closest people, they're few and far between. I'll give you an example. Martin is 100 miles south of me, and the next closest doctor is 150 miles north of me. Nobody in between.
Wow, that's amazing. It's
pretty sad.
It is. And it's a shame I didn't know about you before the conference.
Yeah, well, that's okay. I'm just to be able to see people. I had a woman, matter of fact, I just saw her yesterday for a recheck. She came to me last July, so we're coming up on a 1-year anniversary. Psoriatic arthritis. Psoriasis so bad that the inflammation was affecting her joints. Her skin was horrible. Her dandruff was horrible. She's now 10 months. Yeah, 10 months. She's about 90% improved.
Oh, wow.
The lesions are going away. The joints, she can make a full fist. There's almost no dandruff. Now, we did other things besides that. You know, I don't know if your readers know, well, readers or listeners know, the most common cause of autoimmune disorder is dairy products. Reaction to the casein protein in milk and gluten.
Yes.
So all my autoimmune patients have to go on that, or I can't promise they're going to get better.
Mm-hmm.
But this woman's been really, really strict. But you got to be careful. I have a patient who just told me she found out there's gluten in her chapsticks. So who would think?
Wow.
But gluten's everywhere. So
yes.
You really have to investigate. If you want to take care of yourself, because no one's going to take care of you. The corporations aren't going to take care of you. They're just going to give you something that's easy to use and appears to work and taste good. They have no concern with whether or not it's beneficial.
And how sad is that? I
Can't believe it.
Well, I'm over the sad part. I'll tell you why. I understand it because corporations have one job, to make their stock price go up.
Mm.
Truly. I mean, they don't have a humanistic component or anything else. So be that as it may, my patients need to be educated on what to do.
Mm-hmm.
So it's a lifestyle change for all of this, for cancer, for autoimmune. I mean, we've reversed 3 cases of MS. Well, they are reversing. They're not normal yet, but they're getting better.
Mm-hmm.
That doesn't happen in medicine. I had an ALS patient, Lou Gehrig's disease, actually got off a ventilator, off a wheelchair, onto a walker. So
Fantastic.
it's not me. We're just reversing the toxicity of this world.
Mm-hmm.
So as we say, I'm a satisfied customer.
Wonderful. And thank you so much for sharing your experience with us.
Of course, my pleasure. And please have your readers, if your listeners go to their doctor and say, can you prescribe this? And the doctor says, I can't. Let them educate them. They can. It's innocuous. And if they have any questions or concerns, they can go to my website. All my contact information is there.
Wonderful. Thank you very much.
Wonderful. Have a great day.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.